important, particularly for mental health and loneliness. So without further ado, I'm going to crack on and introduce you all to our wonderful new chair, which is Dr. Ben Spencer, MP for Runnymede and Weybridge. But more interestingly, I would say this, is that he was an ex-HIV psychiatrist. And so his experience in the NHS and in wellbeing and mental health is second to none. So over to you, Ben.
Well, thank you, Tracy, and thank you for that warm introduction and agreeing to chair this really interesting seminar that we've got on to this afternoon. I'm really pleased that we're live streaming this, and I understand also going out as a live YouTube, so that lots of people at home can watch what we're talking about. And I'm particularly thankful for the speakers who are all taking the time out today to go through this really important subject. I mean, look, I think all of us here on the speaking panel really see the impact and the importance of arts on people's health and well-being. This time, COVID has been an extremely difficult time for many people, and I think disproportionately impacted some of the most marginalised people in our community. People who've had to shield, people who've already had and already have underlying mental health problems or need a bit of extra support. And what I'm really looking forward to seeing and hearing from all our speakers this afternoon is the experience they've been having supporting people and helping people through this pandemic. And as Tracy said at the start, what we can learn from this and what we can do to keep on pushing forwards and get out to as wide an audience as possible, just how important the arts are on people's health and well-being. So I'll stop there because I want to hear our speakers and I want to hear the questions from the audience and go forward to see what we can learn and what we can all do from this to make a change in our communities and to make sure that art is up on the agenda in terms of supporting people's health and well-being.
Thank you so much. That was a fantastic introduction. And I know that we will be working really closely together to have an impact on our communities going forward. So just a bit of housekeeping. Our guests will be asked to speak for about 5 minutes, and then we'll have a fair bit of time, hopefully, for questions. If you'd like to ask a question, ask in the chat box or raise your hand, or raise your hand in the little chat at the bottom bar with the symbols. That would be really, really helpful. And feel free to just make comments as well if you don't want to ask a question. Also, so that other people know that we're discussing it, please do tweet along and tweet your thoughts, and do include as many people as you recognize or that you work with. That would be great, just to get a little bit of a Twitter hive going on about what's been discussed here today. So moving on, I'm hoping that Lola Baroness Young of Hornsey is with us. Member of the House of Lords Select Committee on COVID-19, co-chair of the Foundation for Future London. But she's also a woman like myself that used to be an actor and understands very much the impact of the creative industries on our well-being. She was also head of culture at the GLA, so knows absolutely so much about this sector, and I'm really interested to hear what she has to say. So Baroness Young of Hornsey, the floor is yours.
Tracy, I'm not sure she is in here actually. I'm just going to email her and see what's happened because she was here earlier. I don't know if you want to move on to Daisy.
Not a problem at all. Not a problem. And whilst we find her and draw her into our conversation, let's move on to Dr. Daisy Fancourt. Let's hope Daisy is with us. Associate Professor of Psychobiology and Epidemiology, UCL, lead on the UCL Covid study, and is a consultant at the World Health Organization on arts and health, and absolutely knows her way around this subject. So Daisy, it's over to you.
Thank you very much, and it's lovely to be speaking today. So as some of you may know, I've been leading the UK's largest study into the psychological and social impact of the COVID-19 pandemic. So this is called the COVID-19 Social Study, and we have over 70,000 adults across the UK taking part, who represent a very broad cross-section of society. And statistically, we weight all of our data so that it's actually representative of the core population proportions of people on every major demographic factor. Now, participants have taken part every single week since before lockdown came in. So we actually have 17 weeks of data collection now and over 500,000 completed surveys. So this is the same as around 5,000 surveys completed every single day for the last 120 days. So we've got an incredibly rich data source to understand how people have been affected. Now, what we've seen in terms of mental health across this period is that before lockdown came in, most people's mental health got worse. And we found that levels of anxiety and depression, for example, were much higher when lockdown came in compared to usual levels. Now, since then, we've seen that mental health has actually tended to get better for most people. Anxiety started decreasing as soon as lockdown came in. Depression was stable across the strict lockdown, but has been decreasing ever since that started to ease across the 4 nations. Similarly, we've started to see slight improvements in loneliness just in the last 3 weeks. And we've seen that life satisfaction and happiness have been improving across the last 16 weeks as well. However, we're still not back to usual levels, so people are still worse than normal. And importantly, we are not all in this together. We've seen very different experiences in mental health across different groups. So younger adults in particular have been worse affected psychologically across every single measure of mental health. People who had a prior mental illness have not only had worse symptoms across this period, which we might expect, but the gap between them and people without a mental illness has been widening. They've not been recovering as fast from this stress as people who didn't have a mental illness before. We've also seen that socioeconomic factors have been a major determinant here. People who've been lower socioeconomic positions, they've had more financial hardships, have been more likely to worry about different things during the pandemic, including the virus itself, unemployment, and financial issues. They've also been more likely to experience all of these adversities, and these adversities have taken even more of a toll on their mental health than for the rest of the population. So in other words, we know that there are people at the moment who need support to be able to cope with what's happening. Now, a lot of the support that's being provided is coming and looking at different aspects of people's lives, including things like furloughs, financial support. But we also know that lots of people have not been able to access mental health support they normally would have had. So it's even more important than ever that we're able to provide things to help people. And the arts, I think, is something that could provide important mental health support here. So we know that the arts can help people's mental health, including improving well-being and helping to reduce negative symptoms of things like anxiety and depression. And we've looked at people's arts engagement across this period. Now, we found that a substantial number of people are actually engaging in the arts. We found that 9 out of 10 people have done something across this period. This included things like listening to music, which was by far the most popular arts or creative activity across lockdown. We've also found that substantial numbers of people, about 1 in 3, have been reading fiction. About 1 in 5 people have been singing at home. We know there's been a big boom in virtual choirs across the lockdown. And interestingly, we're finding that 22% of adults have been engaging more in the arts than they did before lockdown came in. So this is very interesting because it suggests that people are actually turning to the arts in this period. Now, the key question is, who is doing this? Is this the same people who normally engage? In other words, is there this social gradient across participation? And certainly we see that education and being female mean that you're more likely to have taken up the arts in this period. But actually, we're interestingly finding that wealth is not a predictor of whether people have taken up the arts, nor are certain other socioeconomic factors like household overcrowding. And that's quite different from what we often see. So this is suggesting it's not just the elite few who've been taking up the arts more. Also, what's interesting is we found that people who've been experiencing real hardship have actually been turning to the arts sometimes. People who've been unemployed and seeking work have been 1.5 times more likely to have taken up arts.
I'm not sure if she's frozen for everyone, but I've just lost Daisy.
Yeah. Daisy, can you hear us?
No. That was so interesting. I'll just pick up a couple of those things and just hope that Daisy can come back. But the fact that potentially working class families are accessing culture more than they ever did before. Certainly, I've been looking at some data that would suggest museum attendance at museums, virtual museums, is off the scale. And I wouldn't have assumed that. I would have assumed that maybe Netflix videos or maybe a cooking show online or something along those lines. But actually taking the time as a family to sit and walk around a 3D museum or an art gallery, I think is proof, if that's what were needed, that often it's about accessibility, isn't it, rather than a desire to take part in culture. And certainly if there are no bus routes to your local museum, it's always going to be a slog to take part. So that is evidence, if we needed it, that we need better connectivity between our arts organisations. I'm just having another look, see if we have Daisy back. We don't seem to, so I'll just carry on. Can I just also quickly say that if you want to tweet, it is, the hashtag is hashtag APPG AHW, Arts, Health and Wellbeing. So just give that a hashtag. So it's going to be quite an interesting afternoon with people dropping in and out and maybe not being there, but we are all very creative and flexible, so we can go with the flow. So what I'll do is I'll just move on to our next speaker, who I hope is in the room. Let me just see. Yes, he is. Fantastic. And then once Daisy gets back, we'll bring her in as well, because I thought her data was spectacular, because certainly depression and happiness down and happiness improving was not what I was expecting. So let's move on to our next speaker, and then I'll just go with the flow as people join. So our next speaker is Dr. Neil Churchill, OBE, NHSE Director, Experience Participation and Equalities Group, Covid-19 Workstream Lead for Non-NHS Support for Vulnerable Individuals and Groups. But what is, for me, the most interesting is that Neil, more than anybody potentially on this call, has the most experience in volunteering and volunteers. So I'm really interested, knowing that we have so relied on volunteers over the COVID period. Oh, I see that Daisy is back with us. So hold that thought, Neil, and we'll go and finish with Daisy, because I'm sure there are things we'd like to pick up. Daisy, the floor is yours.
Thank you. I'm so sorry. I had an internet power cut, so the internet vanished very abruptly. But I think I was just explaining to you that actually we're not seeing the usual social gradient in people's arts engagement. So people who've actually been seeking work or unemployed over the last 16 weeks have been 1.5 times more likely to take up more arts compared to people who've been in employment, and people who also were inactive, so people who are retired, for example. And also people with a mental health condition have been 1.4 times more likely to have increased their arts participation. So it suggests that actually some of the people who could most benefit have been the ones who've been turning to the arts. The other really important thing we've noticed is we've been looking at what factors predict people's mental health week on week. And we've been able to do some very sophisticated statistical analyses where we can look at what behaviours are actually helping people the following weeks. Now, what we found is that the single worst possible thing for your mental health in the last 16 weeks has been following the news on COVID. This has been associated with poorer experiences across every single mental health measure. But the things that have been the most protective have been creative things. So gardening, hobbies, arts activities, listening to music, reading fiction. And we looked at a whole range of other things, including work, household tasks, playing games, all these kinds of things. But it was the creative ones that have been the most protective. So it suggests that although we know in normal times that the arts can be good for mental health, it suggests that in COVID, this is very much bearing out week on week in how people are coping. So my final point I was going to make was that I was speaking earlier this week to the United Nations at their high-level political summit on COVID response and how we're going to help rebuild society following COVID. And there was a lot of focus in the session I was on about the role that the arts can play. And it was really interesting hearing the perspectives from many other countries where they're actually investing more in the arts across this period because they think it's going to be more important than ever that we've got these kinds of resources available to people to help in the rebuilding, both in terms of improving people's own personal coping resources, but also helping to provide purpose, social solidarity, connection, over the coming months and probably the next coming years. And I think this is something that really stood out for me, in that I know that it's obviously very easy to see why the arts and cultural sectors are sometimes the things that get deprioritized in moments of crisis, because they might be seen as the entertainment side of life, the sort of inessential things that we can cut back on to focus on the essentials of a global pandemic. But actually, that's not how many countries are responding. And I don't think it's what the data is suggesting we should be doing, because in fact, a lot of these vulnerabilities and problems, particularly on the mental health side, are not things that the health service alone is going to be able to cope with, because of the simple fact that there's not enough resource available to cope with the demands of people's needs. And also the types of needs people are going to have aren't necessarily going to be at the medicalization level. A lot of them are going to be day-to-day coping. And this is something where arts are so fundamental and valuable, and I think are going to play a really important part in helping people over the next couple of years. So I think in my mind, especially, is thinking as we're going in and out of lockdowns as well, trying to make sure we're prioritizing the opportunities for people to engage with libraries, cultural spaces, community venues. This isn't something that's flippant to be thinking about the entertainment. It's something that actually is fundamental to be supporting how people respond. And what we're seeing very clearly from our data is the better people's mental health is, the more they are actually adhering to the government's guidelines to manage the pandemic. So supporting mental health in this time could actually be helping to save lives too. Thank you.
Gosh, that was really interesting. And I would have loved to have been in that session at the UN. I bet that looking at what other people in the world are doing. And certainly, whilst we are very delighted about the 1.57 billion as a package to rescue the arts in the UK, across the world in other countries, there's much more substantial funding going in, because there's that understanding that we're not just a nice to have, but actually part of our, cultural offer to all our citizens. It's not just a side dish or a hot sauce. It's actually should be part of what's on your plate as a given. So that's really interesting what other people are doing, and certainly around libraries where communities might not have a theatre or an arts centre. We know that the library is the heart and soul of so many towns and villages across the country. So thank you so much for that. And if you wouldn't mind sharing your data, we could then circulate it if people are interested, because whilst I made notes, it was very interesting what you were saying. So thank you very much. And it did make the case for a very bold response from government. I'm going to go to Neil and then to Lola. So thank you for coming and joining us, Lola. So Neil, just a quick reminder, and the expert in volunteers and also the director of Experience, Participation and Equalities Group. So Neil, 5 minutes. Thank you so much.
Hey, thank you. Can you hear me okay? You can, good. Microphones are working, and Wi-Fi for now. Really pleased to be with you. So my name is Neil Churchill. I have been leading the work at NHS England around non-NHS support for vulnerable individuals and groups, which is particularly focused on volunteering. It's particularly focused on the role of the voluntary sector. And I think this conversation comes at a really interesting time, because it's important to note that when we responded to that first wave of COVID-19, we were improvising to some extent. It was a pretty unprecedented situation, and the real focus was on people's basic needs. And so that what we were worried about back in February and March was how people will get their medicines, whether people would get their food, how we get medical equipment to people at home to save them going into hospital, how they would get into hospital themselves if they had to do so without having to rely on public transport. So there were a lot of questions like that we had. But now, we've got an ability, I think, with the release from lockdown, to think about how might we do things differently next time. Now, we hope that there isn't going to be a future wave like there was before, but obviously we need to plan for it. And we're certainly seeing spikes in individual towns at the moment. And I think it's an important opportunity for us all to say, well, what's worked, what have we learned, and what can we do differently? So I think this conversation happens at an important time. One of the things, as you said, Tracy, was a fantastic community response to the situation that we were in. Millions of people coming forward to offer help in their neighbourhoods and to the NHS and others. And so with the NHS volunteer programme that I am responsible for, we had 750,000 people come forward. 600,000 of whom were verified, and they've been turning themselves on duty day in, day out over the past few months. And I think it's important to reflect on what we are asking people to do, because I think two things that we have seen is that there have been more volunteers coming forward, both nationally and locally, than we've been able to fully use for that basic set of tasks. But there are other things that people would be interested in doing and might be enlisted to help support if we ask them. So one of the things I've been thinking about with some of the case studies that I've been reading about is are there ways that we might be able to connect some of that community spirit, some of those volunteers who are really itching to do more to help their neighbours with some of these particular opportunities for involvement in the arts and in culture. And I think there probably are more, and both during the COVID response, if there is, where there are future spikes or potentially another wave, but also after COVID has gone, because a lot of the issues that we're dealing with, loneliness, isolation, etc., are here for the long term, and we need to work on them in the long term. So I'd agree that from our contact with for volunteers and with people who were shielding and vulnerable, we certainly heard a lot from groups of people who said that their loneliness and isolation had got worse during lockdown. It's interesting to hear what the overall figures are, but we heard a lot from those people who said it had got worse. We heard a lot from people who said their mental health had got worse. And I think one of the really important things that we heard is that people who were shielding said, look, can you not treat us as passive recipients of care? It's great to get the food box, it's great to get the volunteer at the door, but we want to think about what we can do. We don't want to be those passive recipients of services. And I think arts and culture is a really good way of engaging people with themselves, with their families, with others in creative ways. And so I've been really pleased to read the report about some of the activities that have been going on, and clearly organisations large and small playing a vital role in lifting people's spirits, improving their well-being, and helping them get through a very challenging time. So we've heard a bit about self-isolation at home, and things like the online festivals, the invitations to create that have come from artists, the ability to either deliver things that people can print at home or through the post, or potentially by volunteers, which I think we could consider more. But also I think just looking at how people are getting by in hospital, because we are conscious that we've really tried to restrict access to hospitals. We don't want people to be exposed to catching coronavirus in hospital, and things like the boredom busters have gone down very well. We held a meeting about it last week with NHS trusts. And I think we have an opportunity here from moving from a reasonable number who participated in things like this to a much larger number in future. I was very pleased to see that quite a high percentage of these initiatives has happened with partnership with the NHS, although a very low percentage having funding from the NHS. So I would be very interested to find out more about those who had funding and where that funding had come from, and we can understand how we can encourage more people to think about it. But lessons for me, I think that clearly COVID-19 is not over. We are dealing with future spikes. We are dealing with people in lockdown now in places like Leicester who might come into those kind of restrictions. We do need to prepare for a second wave. And so I would very much like to think about how we can build on the experience of what's worked from all of these arts organisations, and try and enable more people to benefit, particularly those people who told us and told their volunteers that their mental health, that the loneliness had got worse in the experience of lockdown. But I think there's a tremendous opportunity for the world post-COVID in how do we enhance some of this community spirit into social prescribing in the way that's been mentioned. I was delighted to see that social prescribers were very, very active in terms of referring people for support for volunteers. Obviously, what those volunteers could do was quite constrained because they had to keep a distance from the people that they were supporting. But we can think about worlds in which much more is possible. So what I'd really like to come out of this is a much closer relationship between the NHS, artists, arts and cultures organisations, so that we could do the things that we have been talking about prior to COVID. But actually, I think COVID might have accelerated in some localities thanks to the fantastic work that we've been seeing.
Thank you. That was a fantastic gamble through the work that you've been doing. And also, we can't forget either that certainly in Kirklees, we've had local clusters of COVID. but it's under 40-year-olds. They're not getting the messaging. So we're using culture and creativity to try and get the messaging to them about what to do to protect themselves. They may be asymptomatic, but then they give it to their grandparents. So it's also preventative as well as once, you know, you're shielding or you're unwell. Can I just ask you a question very quickly? From John McMahon, who said that from the Arts Council end of things, that they know that much of the sector's traditional volunteering base, especially for museums and heritage, may be less inclined to volunteer for the foreseeable. What's your thoughts on that?
Well, it's been interesting. So we had this to some extent with the NHS, because if you think about people who ordinarily volunteer for NHS hospitals, they tend to be in that civic core of volunteers. So older people who have retired, just the kind of people who were more vulnerable to COVID. And actually a lot of those volunteers aged over 70 were stood down by NHS organisations. What we saw from the NHS, the community response to the NHS volunteer responders was a more diverse range of people coming forward. And so 43% of the NHS volunteer responders are aged between 20 and 40. So we've got a lot of people coming to help the NHS who hadn't previously thought about helping the NHS or didn't know how to help the NHS. And now, as lockdown is lifting, the over 70s are wanting to come back. And obviously we're wanting to make sure that they do that in a safe way, and we're thinking about how that might work. But I think we would see that the experience of volunteering through COVID has helped to diversify the range of people who came back. We had a long-term plan ambition to double the number of volunteers involved in the NHS. That has happened in 3 months, thanks to COVID. But I think we really want to think about what those people can be doing, because simply the kind of task we have people for in the NHS, the basic tasks I was describing, are not enough to keep everybody busy, but some of the things that we might do in the social prescribing sphere are actually potentially much bigger. So we would like to keep the people who've come forward and also bring back, when it's safe, the people who've been stood down or who are nervous about coming back to volunteering.
That's potentially very exciting for the volunteering sector to have a sort of double bubble. Also, I'm going to speak to my trust, and everyone on this call, on this webinar, should speak to their trusts about boredom busters to make sure that they're in the loop on that. Thank you so much, Neil. We have to move swiftly on, but there will be time for questions later. Thank you, Lola, for joining us. Baroness Young of Hornsey, a member of the House of Lords Select Committee on COVID-19 and Head of Culture at GLA. The floor is yours. Thank you so much, Baroness.
Oh, well, thank you. Just 3 quick things. First of all, please call me Lola. Second, I haven't been head of culture at GLA for about 15 years, and I need to apologise profusely because due to my own incompetence, I was rather late for this session. So sincere, deep apologies for that. When I sort of looked at the title of this session, I said to both Alex and to Alan that the issue of vulnerability is a difficult one, actually, because there are different ways of being vulnerable. And as has already been said, and I've heard it many times now, absolutely correctly, that the idea of vulnerability places the person considered vulnerable in a particular space into a particular kind of category. And often that is a subordinate category. You have to be done to or done, you're not kind of seen as a free agent. So it's quite a difficult concept. So my remarks are not addressed to that kind of vulnerability. What I'm thinking about, two or three key things. As you've correctly said, I'm a member of the House of COVID-19 and Beyond Committee, and the Beyond bit is really important that we think forward on that. And where we're connecting quite profoundly, I think, with the arts is in terms of asking people to submit what they think should happen. So it's our evidence call has not just gone out to the usual suspects, one might say, the usual experts. It's gone out to those, of course, but it's also been about very much saying to people, write us a poem, send us a video, make a film, write a short essay, write a long essay, and tell us how you see we can move from this point in COVID-19's history into a future that might be 2 or 3 years in advance. So it's quite a different way of working for a select committee, and we'll see the fruits of that. We're already beginning to see some fruits of that, actually, although we've only had a very small number of submissions. And I would urge everybody, whether they belong to an organisation or to particular community or as an individual, to let us know what they think. How can we do better? How can we improve our sense of well-being? So that's that part of what I wanted to say. The other thing I want to say is that my feeling is that for me, and I think for a lot of other Black people, this COVID-19 has really exacerbated the inequalities that we experience in this society and elsewhere, globally, one might say. And that is a really, really important point on its own. But when you add into that the murder of George Floyd, you're talking about a huge, huge and very difficult experience for a lot of Black people in this country and as I say, elsewhere. And especially in relation to the whole Black Lives Matter movement, needs to be a separate subject. I think this APPG would do well to consider that as something which needs to be explored, particularly in the context of arts. Because here as anywhere else, I know people in the arts and cultural sector like to think of themselves as being really kind of tolerant and liberal and all the rest of it, and that you know, to some degree is true. Nonetheless, systemic, heavily embedded racism and discrimination are to be found throughout the cultural sector. And please don't ask me to give you examples, because there are plenty. So what I'm looking at now is in that context is thinking a number of things. One is around Black artists and the extent to which they're going to be able to be bailed out by any government funds. We do not have national organizations. And the fear is, I think, that a lot of that money will be going to national, well-recognized, well-established organizations. And by the very nature of our part of the sector, there isn't a superabundance of organizations that fall into that category. That's one thing. The other thing relates to this issue around mental health. In fact, 2 or 3 of the submissions that we have had to the COVID committee have concerned things like loneliness and community. And I think that's a very important thing. Now, clearly, mental health is another area where Black people have endured some very difficult outcomes. So the idea that we've got all of these different factors piling in on us, I think will produce a lot of issues for various Black communities around the country. Now, clearly arts and culture is a way of expressing that, communicating that, dealing with that. But again, if we come back to the situation in which many Black artists find themselves, they're not able to fully express themselves due to the kinds of structures and systems that we have in the ways that are necessarily open to white artists, to make that kind of generalization. It was interesting to me, and I have to declare an interest because I'm a patron of Autograph ABP, ABP standing for the Association of Black Photographers, but it's much wider than that. Autograph have a very clear mission, which is amazing photography and photographers combined with a real keen sense of human rights, anti-racism, anti-sexism, anti-transphobia, and everything, all that kind of whole equalities agenda. And if I would recommend people to go to the website and look at rights in the light of COVID-19, race and migration. As I started off by saying around this segment of what I'm saying is that all of these things are very much intertwined, I think, for many of us who work in the sector. And what we'd like to see, I think I can say we because of the people that I've spoken to, certainly would like to see a much more nuanced, much more substantial response from all sections, all sectors to the circumstances in which we find ourselves, but particularly around arts and culture, because these are ways in which we can communicate and explore some of those really difficult issues. It's not easy to say to a room full of white people, well, look, look at this, this is how we're treated, this is how we feel. We need to be able to find ways of communicating that. And I would hope that this is something that would contribute to everybody's sense of well-being, mental health and belonging. That's it.
Thank you so much. That's absolutely brilliant work. And we've put in the chat how to submit to the inquiry. But also just to reassure you as well, Lola, that I'm very worried that that COVID, in my role as Shadow Cultural Industries Minister, that COVID will decimate that inclusion, diversity and equality agenda. And I've made it my priority to make that argument. I've set up a cultural committee to draw together those people who need to be part of the conversation. And we also submitted to the Doreen Lawrence inquiry review on the impact of COVID on the BAME community in the arts. So I can also share that with you if that's of interest. Sorry.
Could I just quickly say, yeah, sorry, that's great. And, you know, if you want to have a conversation about that offline, there's a bit of a movement on now, and this is not to have a go at you individually, but can we scrap that term BAME? Because, you know, whenever I talk to other Black people or indeed people of South Asian descent or from elsewhere, we don't recognize ourselves in that term in any way whatsoever. And it's become a kind of administrative / policy thing that kind of sweeps everybody up into one category. And what we need to do is disaggregate and look more closely. So as I say, it's not about you on a personal level. I'm saying to everybody, please don't call me BAME.
And so I agree with you that it's become convenient sort of understanding. And so people of colour is in my report. So I'm hoping people of colour will maybe be more inclusive. But maybe Lola, I could talk to you offline about that. So thank you for that advice. So moving on, we are moving on to Ellen Rule, Director of Transformation and Service Design, Gloucestershire CCG. So one of the organisations of many around the country that actually make this social prescribing and work happen in hospitals and in communities around the country. So Ellen, over to you.
Thanks, Tracy. And I don't know if that was my broadband or you breaking up a little bit. Can you hear me okay?
I can hear you fine.
Brilliant. I'll just make sure I've turned a few other things off just so we're absolutely sure it's not going to break. So that introduction. So yeah, we are one of the organisations using creative health as something we use across a whole range of our programs. And one of the things I think that we've pioneered in Gloucestershire is thinking beyond the use of arts in general well-being, where I think it is really important, but moving on to what we call social prescribing plus, so actually where arts can support health interventions within and alongside medical pathways. So when we started with the incident response back in March, which seems a really long time ago now, but actually isn't that long ago, arts was already something that was embedded in Gloucestershire in the way we do things around here. And so for us, it seemed natural to think about how arts could help us in our COVID-19 response as well. So in our system response in Gloucestershire, we set up what we termed a number of bronze cells working together across our system between health and social care. And thinking particularly first about this shielded and vulnerable category. So for us in our population, 20,000 individuals living in our community. And we set up and mobilised a helpline pretty much as soon as the incident started, redeploying staff from across our system, from the CCG, from clinical roles and so on, to phone every single person on that list. So our aim was to phone them all, check in them all, understand whether they were receiving support, to network them into community help hubs that we set up with our district and county councils. and to think about if they were receiving the medical care that they needed, obviously, as well as wider social wellbeing needs, and just practical stuff like if they needed food parcels, were they getting them, and so on. And as part of that, we used our existing social prescribing service that we have at scale across the county, and our lead for culture and the arts and health also formed part of the leadership team. So when we were talking to people about their wellbeing, we were also asking about these needs as well, and networking people in with additional support. And we've got a partner organisation in the VCS called Create Gloucestershire, and they've done some really innovative things like putting creative resources into food parcels, and also where we've seen amazing mobilisation of community offers to the NHS, which has been amazing, I must say, across the board. We've had offer of venues, really fantastic cultural venues as well, to help bring people together when it's appropriate to do so, as a resource to support people at this difficult time. And thinking about then moving on to some specific examples of where we've deployed our arts and health interventions at this time, including some of the adaptations we've made, I'll just give you a few examples. So for adult patients, we already had a support using singing for breathing, and we've continued to do that with around 90 participants across 7 locality groups. So we've done online singing lessons, including breathing exercises and warm-up. Pulmonary rehabilitation staff have joined those Zoom sessions to see patients and provide info. And sometimes we talk about digital exclusion, but to give you one example, we have a 93-year-old who literally never used a computer before. And he said, my coughing has stopped by attending these classes, and seeing everyone, even on a screen, is wonderful. So it just speaks a little bit to the difference that these offers can make to people, particularly when they've been literally isolated in their own homes. And where the rehabilitation clinical staff joined with the artist delivering the singing side of it, they were also able to physically see those patients and provide information for them if they felt they needed some clinical input at that time. Another example is we've offered music therapy for couples where one person is diagnosed with advanced dementia. As you can imagine, isolation at this time has meant something, often the home situation for these people is really difficult, and something different for those of us who are just at home with sort of our normal arrangements. People have lost carer support and the ability for those people to go out and access lunch clubs and other respite care they might have usually got. So we've delivered some sessions in the gardens with the explicit permission of police, singing with those people with advanced dementia, and also providing some respite support for the other half in the couple, the other person living in the home. And that again has been a blended approach using our VCSE sector, but also the clinical dementia team and the primary care referrers. And we have plans for enhanced support around loneliness, and this will be using storytelling circles, people referred by social prescribing. And we're hoping to be able to do some of that face-to-face outside, but we're just working that through. And then just to give you a few more examples where we've used this for children and young people. So for people with diabetes, children and young people with diabetes, we already had a circus skills and mixed media arts offer. And they've continued that through this time, sending art boxes, using the telephone, doing one-to-one mentoring and coaching sessions online. And the same with a service, quite a bespoke service actually. So we have around 30 young people who live with chronic and persistent pain in our county who don't engage with education. And we provide a support service to them using songwriting and singing with a music charity. And they've continued to offer those sessions one-to-one, a mentoring and coaching. And actually, this has worked really well doing online delivery, and they made an absolutely fabulous and heartwarming video to say thank you to the NHS, and have done some songwriting as well. And actually, they've talked about more trust developing and going to a more sort of creative depth actually with the one-to-one support. So that's been really positive. And then we're also developing an offer now around anxiety support, particularly around, this is based on what schools are telling us, for year 6s and year 10s, and that sits within our broader mental health offer, but again, that will be using music and songwriting. I think what I'd say is that as well as thinking about a joined up approach and coordinating that, we've also been collecting data and reporting back and how the experience has been for people who've taken part in that, but also for the organisations who've helped us with delivering that. And I think collecting that data, as Daisy talked about in her presentation earlier, is really important to ensure we've got an insight into how that's landing with people and how we can develop that further. But for us, I would just finish by saying we see this as being integral to providing a joined up response. And I would also echo the reflection earlier that whilst I think some people have been resilient through this, our experience is that certainly people are reporting increased levels of anxiety and other indicators of need, such as reports of domestic violence and child protection referrals and so on that others have described across the country. We're starting to see that come out now. Obviously, we saw a lull when contact points like schools and so on not really operating, but we're seeing that starting to pick up again. And so I think there is a very much increased level of need out there. And if we think just about traditional services, they are not going to be able to plug that gap. And we also have significant backlogs in our NHS services. So if we don't think more broadly about how we can meet those needs and deploy all of our community resources, then frankly, we are not going to sort of make a dent in it, I don't think. So we see this as being absolutely critical to how we can support our communities and think beyond just what NHS services can do. So yeah, I'll end there. Happy to take any questions.
That was really, really interesting. And if we've time later, we could discuss maybe what percentage of the work that you're doing is going to stay online, or is it going to be that hybrid mixed approach? So that would be fantastic. I am going to push through because I know that there will be people with lots of questions. So if you just bear with me, we'll go on to Councillor Julian Germain. Is he here? Can I see you? Yes, great to see you. The leader of Cornwall County Council, Vice Chair of Culture, Tourism and Sports, the LGA, but also what's really important for me is that you're part of the Arts Council England rural stakeholders, so you will have a different take to the take of a big city leader of the council. So over to you, Julian, thank you.
Good afternoon. Thank you very much, Tracy. Cornwall Council governance is a topic of interest at the moment. So we're a large rural unitary, the only one without a mayor and a devolution deal. So it's good to set that focus. I think the only devolution deal with culture as part of it as well. It's a fantastic panel. I'm humbled to be part of all of the expertise that there is here, but hopefully I can give a different perspective from local government, from rural, about what's happening here. So I thought it'd be useful to start with a few words on how we created the strategic platform for bringing arts and health together, perhaps not as exciting, but really important in terms of being able to deliver, and then some of those practical examples of delivery on the ground. So in 2019, Cornwall Council established a creative health and wellbeing partnership in recognition of the distinctive contribution that the wider arts, creative and cultural sectors make to improving health and wellbeing of individuals and communities. So this partnership is also a response to your report, Creative Health, the Arts for Health and Wellbeing. The partnership's been jointly commissioned by the Culture and Creative Partnerships team and the Public Health team at Cornwall Council. The aim of the partnership is to develop capacity, skills, knowledge and resources, connect people, organisations and programmes, and attract additional investment. So the timing for the establishment of the partnership also linked locally. This is one of the joys of local government, but really important that you've got your ducks in the line. So with our 10-year health and wellbeing strategy for Cornwall and the Isles of Scilly and our new culture and creative manifesto. This partnership's looked at how creativity can support mental health and well-being of people during the pandemic. Arts Well, a Cornish community interest company, has been commissioned to run the partnership and delivering online mentoring and support sessions to self-employed artists and facilitators working directly in the community. So they're working with the vulnerable residents who can be supported at this time. We're supporting the people doing that work. Individuals and organisations have stepped up to the challenge and continue to show how the vital role that arts and creativity can play in people's lives. In Cornwall, some exceptional projects have been taking place to tackle isolation and encouraging wellbeing through creativity. So a couple of examples of those. Dance Centred has created beautiful postcards which they posted to vulnerable adults to encourage them to dance, enjoy music and move. Sundance has also encouraged people over 50 in Cornwall to dance every day, keep mobile, keep active and keep connected, also using postcards as part of their armoury. Newlyn Art Gallery has adapted their tea, cake and art sessions. So older people would normally attend an artist-run workshop, make friends and socialise, as well as discover or rediscover creative skills and confidence. Very few of them had used Zoom before, so Newlyn Art Gallery's digital programme producer set up one-to-one tutorials and a trial Zoom group at the end of March. For those who couldn't or didn't want to meet online, Newlyn Art Gallery posted out activities each week, so still keeping everyone connected. The Culture Card, run by Cornwall Museums Partnership, has sent craft and art materials to vulnerable care leavers. This project has provided online artist-run sessions to encourage these young people to continue to be creative throughout this challenging time. All these projects have been funded directly or indirectly from Cornwall Council, many through Feast, which is an organisation that brings community and artists together. The local government association is soon going to be publishing a case study report on the incredible role that cultural organisations have played in supporting people's health during lockdown. So hopefully that can be part of the evidence to the APPG and also Baroness's Young's Select Committee. So in conclusion, local authorities are well positioned to allow creativity to support people's wealth and well-being and health. We're in an exceptional position as we cover public health, social care and culture under one organisation. But this work can only happen with those strategic partnerships, with the commitment of individuals as well as organisations to work across organisations collaboratively to make the biggest impact possible for our residents. And finally, I'd like to highlight that this work relies on exceptional cultural organisations and creative individuals. Covid-19, as we've already talked about, has financially weakened the cultural sector. So we need to ensure that funding opportunities are still available. And I'm sure you're all aware of the financial challenges facing local authorities, and that these activities, whilst we can absolutely see the benefits, see that they're cost effective, that they have preventative qualities, are likely to be difficult to protect when we've got less resource, difficult financial decisions to make, then they're going to be really difficult areas for us to protect in our budgets in the future. Thank you very much for the opportunity. Happy to take any questions.
That's so interesting, Julian, and that cross-departmental work must be the way forward. Also, I know that social prescribing and community arts is a way to support freelancers and the self-employed, who at the moment, so many are slipping through the financial support network. So this is another opportunity to earn a living. So thank you for that. We'll leave questions towards the end, but thank you for your contribution. Very, very interesting. So moving on to Natasha Duggan, an expert patient and community artist, and part of the New Forest Climate Climate Action Group. Natasha, I'd love to hear your thoughts. Thank you.
Okay, I'll just share my screen. There we go. Get my text. Oh, there you are. You're up there. Yeah, so I'm an expert patient, but also an artist. So as you can see from the image, this was my gratitude poster to the NHS in, I think, 2013, when I had revascularization of my renals. Now, the work here is a piece of art, really, by the old surgeons at St Mary's in Paddington. And yeah, it's taken sort of over 10 years. But yes, this is the complications and things that have led me to be a comorbidity patient, which means I am shielding. And unfortunately, my family have to shield with me. We are quite used to uncertainty, and we have adapted our life over the sort of decade of moving around and having to change things. And we've had to slow our lives down a lot. But one thing we're used to is redefining our days. And I think initially with the lockdown, we went into, there was a little bit of flight or fight kind of, I think we reacted like we're in survival mode. And we went into lockdown before the government said, because I think we kind of I suppose I had a call from my GP, and I had a text from a surgeon, and just to say, keep out the way of COVID, keep out of the path of COVID. So yeah, I think there was anxiety at first, but we got into a flow of redefining our days by being creative. And my daughter is 15, and it's very challenging for her. It has progressed, so every day is different, but we use some creativity in some sort of way. So whether it's painting, or my partner, I suddenly have a permaculture garden. Sort of within 3 months, he's designed a garden, and those things wouldn't have happened. So there's always something that grows out of these situations. Yeah, so we definitely use creativity to cope, and have done over the decade. Things are a little bit more confusing now that we're transitioning out of lockdown, because I think my daughter definitely needs to see more friends, and there's people are not sure about what the rules are. So there are some friends that are fine with social distancing, and others that are like, oh no, we've had enough of that. So I think the anxiety levels for her have risen. Yeah, it's a challenging one, but yeah, I use art all the time, and if I'm restricted to a hospital bed, I just draw, and I fill sketchbooks, and I can travel in and sort of extend myself beyond my surroundings, really. And it just takes you deeper into yourself and your resourcefulness. So I think I'm filling in. It's funny, Daisy's her surveys for the UCL, and I've been doing one every week for the Imperial College, and that's has been asked me about well-being. It tends to ask about what exercise I've been doing, and there's I'm no Joe Wicks person, because I'd spring a leak. I really have to think about keeping my blood pressure low, and so I'm not big on exercise. So my mobility and stamina as well. So but yeah, so I have to. The arts, it's arts all the way for me. But I have been in the past a community artist, so I am well aware of creating a space for people to express themselves. So it's something I do for myself, and it's something I've done to help to bring about kind of community art projects. And this lockdown, I've sent out patches to people to do a patchwork, their reflection of lockdown reflections stitched in lockdown. So those have come back, and that's how, you know, sort of it's isolating within your family, but I'm not, you know, obviously it's, you know, it's lovely to be together, but you know, you have to kind of make contact with other people. I did actually join a Zoom, an art Zoom, which was, I think the Pool Council had provided, and I happened to know the Wellbeing officer, and she had invited me, and it was the first time I'd actually managed to get along, and it was really nice being on with a bunch of people that were just there to do an art activity together, and it was really fun, and I was laughing, and I was really surprised how smooth it all ran. So yeah, I think there's so much more room for these kind of projects to kind of reach out to people who are shielding or, you know, have health restrictions. So yeah.
And would you say, Natasha, that you are an artist anyway, but do you see the value still in people who aren't artists get involved and have things delivered to them? I'm assuming you get your stuff, things don't come to your door.
Yeah, no, I haven't had to rely on outside sort of stuff. I have a lot of resources through having worked in community arts, and I use a lot of recycled materials. But yes, the project I put out for the patchwork, you know, people were emailing me, and I would arrange for somebody to drop something off, so sort of creating a little kind of network. But yeah, so that's there's definitely been people there that haven't had the time, I suppose. A lot of people that just don't make time for it, and then they've suddenly sort of said, oh yeah, this is great, I like slow sewing or something, or and some people were like, no, I don't want to, you know, you're bugging me. But in the end, they ended up kind of going, oh, I really enjoyed that. So yeah, it's funny that lockdown it pushes you to kind of find your way through the kind of restriction. So,
well, you're a really amazing advocate for how it can work, and you know, more power to your elbow and your garden. And when it comes to fitness, actually participation in art or culture is as good for you as going for a half-an-hour run. So I wouldn't worry about exercise.
That's great. Now you've told me that.
So we'll save up questions for you, Natasha, at the end. But
lovely.
I'm very time, so I'll move on. But thank you for that really
thank you.
Honest evidence base. Thank you very much.
Thank you.
Going on to Victoria Hume, the Director of Culture, Health and Wellbeing Alliance, and also a composer. So I'd love to hear from you, Victoria. 5 minutes, thank you.
Thanks. So yes, I am the Director of the Culture, Health and Wellbeing Alliance. We're a free-to-join membership organisation. We have about 5,000 members, and we were born in part from the Creative Health Report that this APPG produced. But we're an organisation that's driven by the collective power of our members, and one example of that is the case studies in the report that that Neil referred to earlier, that you've all had with the agenda. And I'm going to talk a little bit about that. But first, I just want to thank all the organisations that sent in case studies. You will, if you've read it, see how much time and energy is going into delivering the work. So finding the additional time to then write about it is actually no mean feat at the moment. So the report focuses on work that's been designed to support people who are shielding or vulnerable at home. And I just want to point out that what it doesn't tackle is the immense amount of work that's being done in hospitals, care homes, hospices, all sorts of health institutions. And we're hoping to do a second report on that soon, but it isn't in this one. It's also not comprehensive. There'll be many, many projects out there that we haven't included, but it's really just to give some sense of the variety and scope of this work, which you've been hearing a lot about already, actually. Just to give a few details about the report, there's almost 50 case studies, and And we estimate that the organisations and freelancers that have done that work have reached over 100,000 people, which is quite a significant amount. The work varies enormously in terms of reach. So you've got really small, tightly focused projects like Quorum's Letters in Lockdown, where they've worked with 13 young people, to Greater Manchester Combined Authority, who've been delivering 38,000 packs. But I say 38,000, but it's not a scattergun project. The packs have been co-produced with the people that they're intended for. They've been put together by a huge collective of cultural organisations. They've been sent out with the support of community partners, with health and local government partners, to make sure that they reach the people who really need the support. And that sort of careful, targeted approach is typical of the case studies. There's lots of other organisations who've, as Ellen was saying, collaborated with food banks, or with local support groups, or with social workers. So really, whatever the scale, what's significant is the care that's been taken to be responsive to what people actually need, whether it's a pencil sharpener or support with mental health helplines. It's very early days for evaluation of these projects, as you can imagine. So a lot of them have, some have been going since March, but with very little opportunity to evaluate. But the feedback that people have been getting suggests that people are really seeing this work as a lifeline. One participant talked about feeling as if they were getting VIP treatment. And in other case studies, people have talked about how important it is to know that they haven't been forgotten. I was on the APPG for theatre group this morning, as Tracy was too, and Robert Softly Gale was speaking from Birds of Paradise Theatre Company brilliantly. And I'm just going to quote him. He said that disabled people have been classed as vulnerable, and the visibility of our contributions to society has been reduced. And that's really true across so many of the groups that the work in these case studies is supporting. Neil also talked about this thing of people not wanting to be seen as passive recipients of care. And at a time when all we're hearing about certain groups is their vulnerability, being treated as valuable, creative, contributing citizens, not being othered, is so critically important. And these projects are creating vital space for people to express not just happiness, but frustrations, fears, anger, and to articulate the need for big changes in society. And this, of course, links to what Baroness Young was saying earlier about broader inequalities. Quite a few of these projects have, the Black Lives Matter movement has been quite a central part of a number of them. I'm thinking especially of Quorum, Intermission Youth, Liverpool Museums. Another critical aspect is the emphasis on offline activity. So this has come up a bit already today, but there's a clear crossover between the people who are most likely to be isolated or feeling the worst effects of the pandemic, and a limitation on digital access. So lots of these organisations have deployed a mixture of on and offline approaches. Some have gone purely offline, and the offline work has varied hugely. In some cases, it is this targeted distribution of creative packs. In others, it's phone calls, phone workshops, creative exchanges by post. Sometimes it's even socially distant dance classes in driveways. The online work is all sorts of different things: workshops, resources, exhibitions, festivals, performances, peer support, social media, workouts, anything that you can imagine in an online space. And the work's generally being done by organisations with a history of social engagement or focus on health. So it's often been designed to tackle quite specific issues, whether it's postnatal depression or supporting people with chronic conditions. But the vast majority, as you would expect, is directly addressing loneliness and social isolation and supporting well-being.
Sorry, Victoria, we're just so pushed for time. If you just make your conclusive comment, apologies.
No, that's okay. I think the real point I wanted to make is that what these case studies make clear is the need for partnership. So it's about investing in these organisations that have been doing so much to support communities, but it's also about investing in time into partnerships between culture, health, social care, local government. We just can't afford to work in silos anymore. The resources aren't there, and it doesn't work. And this is a real demonstration, a modelling of how we could see partnership working on a much larger scale.
Great conclusion. Thank you so much for your brevity as well. It's really appreciated. If we could move on to Vikas Kumar, MBE, Director of Gem Arts, Gateshead, and the engagement that you've built up with people of colour in your community is also of interest. So over to you, Vikas. Thank you.
Thank you, and thanks for inviting me on today. I've just got to, I know I'm going to stop, but I'm just going to apologise straight away to Baroness Lawler, because I am going to use that terminology just because everyone's all fair with BAME, you know, and I absolutely agree with her that there needs to be a bit more nuanced discussions about that, about representation. So apologies to start off with, and I'm going to wince internally every time I say it. So Gem Art, we're an award-winning arts organisation based in the northeast of England. We're an Arts Council-funded national portfolio organisation, and we're a recognised leader in the South Asian and diversity art sector. Gem Art creates and programmes concerts, events, festivals, workshops and commissions with regional, national and international artists across all art forms. Why do we do it? Well, we do it because we believe that art enriches the lives of individuals and communities through celebrating our shared cultural diversity. We specialise in high-quality art-based projects with socially isolated and excluded BAME, asylum seeker, refugee and wider communities. Over the last 20 years, we've built an excellent track record and accrued considerable experience and knowledge in the co-production, management and delivery of art projects in the region, working in partnership with the public and voluntary sector. Cultural Threads is Gem Art's flagship arts, health and wellbeing programme. Working with vulnerable BAME and wider communities across Gateshead and Newcastle, we use creative engagement to address isolation and loneliness and to improve health and well-being. People that we work with have various physical and mental health issues, including those on long-term medication, diabetes, high blood pressure, high cholesterol, anxiety, stress and depression. And many of them face racism, as well as other social, economic and cultural barriers which lead to low levels of physical, mental and social well-being and health problems. Our arts programmes enable people to develop new creative skills and interests, engage with others, build their own confidence and develop community networks to improve health and well-being, and celebrate cultural identity. The COVID-19 pandemic has disproportionately impacted BAME communities and has further amplified racial and health inequalities that already existed. We know that many people from BAME communities in Gateshead during lockdown are feeling more isolated, lonely, scared, worried and vulnerable, which is having a negative effect on their health and well-being, with women, older people, children and young people at greatest risk. Prior to lockdown, our artists were delivering regular weekly sessions face-to-face with participants in community settings. Very quickly, we had to respond and adapt our delivery to meet the needs of our communities and those who are shielding. We run regular lunch and arts clubs for vulnerable families, and as lockdown meant we could no longer deliver this vital work, so our amazing volunteers came together and we are now cooking healthy Indian vegetarian meals and delivering them with fresh food parcels to vulnerable families and individuals in Gateshead. Initially, when we start the hot meals, we were delivering 40 per week. This has now increased and we're now delivering up to 100 meals per week. We're also receiving referrals from local schools via their family support workers and envisage demand going up over the summer holidays. We've also been working in partnership with Gateshead Council and Connected Voice to create multilingual language COVID-19 advice videos with our volunteers. Gem Art has been creating a mixture of online and offline arts activities because we're very aware that many individuals from our communities are feeling especially isolated at this time due to digital exclusion caused by lack of access to online support and advice. They're not able to afford broadband and electronic devices, safeguarding issues, lack of privacy in extended family households, or not having the necessary digital skills. This is especially true for older people in those communities and those who have English as an alternative language. So we've commissioned a range of local artists whose work reflects creative and cultural diversity to produce online content as well as creative packs of activities, which include arts materials, and we have delivered these to our regular groups. We've also been delivering the arts packs with our weekly hot Indian meals to families in Gateshead. Creative content includes Chinese block printing, origami art, Bollywood dance sessions, doll drumming, sign making, creating your own mandala, and Kathputli puppets from Rajasthan. And we've been exploring through creativity, diverse narratives of resilience, kindness, and hope. We've had amazing feedback from our communities. We've created WhatsApp groups so that people can share their creative artwork with each other, stay connected, and offer encouragement and support at this very challenging time. Gem Art has shared some of the work across our digital platforms, and social media. And we're currently collating all this incredible work to be exhibited digitally. And as lockdown restrictions relax, we will exhibit the work in community spaces and venues, in addition to delivering art sessions within community settings face-to-face again, as that human connection is so vital to our work. I'd just like to take this opportunity as also to say a huge thank you to all our brilliant artists, volunteers, funders and supporters and GemArts team for delivering this really important work, which is making such a positive difference to people's health and well-being in our communities.
Fantastic. Thank you so much, Vikas. And honestly, the work you're doing is very like slung low in Leeds. You're light on your feet and transformative. If everybody's okay, we're just going to overrun by 5 minutes. I think the tech at the beginning was a bit of a problem. So Patrick, last but not least, Chief Executive of Heart of Glass and a national leader on the most amazing scheme from the Arts Council, which is Creative People and Places. Thank you, Patrick.
Hi Tracy. Hi everyone. I'll be brief because I know I've got the graveyard shift here, and also my neighbour started to do DIY, so that might interfere with the presentation. So I'm going to really speak more from a qualitative perspective, because we've obviously heard a lot of kind of quantitative data and examples. And really, I suppose where my head is at the moment is how the arts and cultural sector can remodel or transform from the learning from this moment, so how we can reform and reframe and be a source of leadership and solidarity in a more significant way in the future, because I think we really have to pay attention to what's happened in this moment, because I think it's amplified certain things that we have a responsibility to listen to. And I suppose the first thing that I would say is to not just be part of the arts life of a place, but actually the civic life of a place for the communities in which we inhabit. And I think quite often the arts has been accused, and there's many examples of that kind of insularity, of kind of inward looking, and that we create these kind of cultural spaces and palaces for people like us and for each other. But really we have to walk in tandem and in solidarity with broader civic life in this country. We know that this work happens. We have no shortage of case studies or evidence. I think where we failed is that we failed to recognize the value of this work and the labor of this work and the skills necessary to do this work. And this really needs to change. There's a hidden scaffold that more and more people are becoming aware of, that underpins the arts and cultural heart of this country. And it is more than bricks and mortar, it is hearts and minds. And it is more culturally democratic than the quote unquote kind of traditional arts infrastructure that we have a tendency to prioritize, because it's less visible. It's process based, it's cups of teas, it's community centres, it's libraries, it's empty shops, it's taxi cabs, it's cafes. In this pandemic, what I've observed and what I've felt, you can find out more about our work online and various things that we've been doing and various peers and colleagues. But what's become more important, I suppose, is not the systems and the structures, but the work itself. And we have to find a way to hold on to this. I've really observed that there's been a kind of disappearing of some of the kind of layers of bureaucracy that we have to work through. Like, for example, we started off with an aspiration to do 10 projects with people working from home. And then we were able to ring local authorities and other arts organizations and say, if you put in a bit of support and you put in a bit of support, we can grow this. And we grew it to 51 projects. That wouldn't happen ordinarily, because people wouldn't have the gift or the will or the mechanisms to be able to move so fleet of foot. So we have to hold on to that. We have to prioritize our soul over the symbolic, the content over the structure, and it needs to be intersectional. It just has to be. The work we've all described happens all over the country every day. It's what we do, but it is quite often marginalized in terms of recognition and resource. And I'm really thinking about the relief package at the moment when I'm saying this. There's a shared belief also that the very communities that we often view as our most vulnerable, and I really appreciate this thread of conversation today, the people that we view as most vulnerable are also the people that have the social capital that would enable us to build a new world. What we're experiencing now in terms of isolation and unjust treatment is what a lot of vulnerable and marginalized folk experience daily. They have the knowledge. It's largely unwanted knowledge, but it exists. So I really feel that leadership from the margins is where we need to look and build from. So in summation, what have we begun from the principle of putting our communities and our artists first, including funding them in ways that makes inclusion, diversity, and cultural democracy real possibilities? What have we begun to recognize that large institutions and their buildings are no longer relevant in the same way? They're still relevant and still valuable. But what have we really begun to examine and dismantle? Systemic racism, structural inequalities. And what are the devastating impact of COVID-19 on individual artists and communities they work with led us to rebuild an arts sector that is more collaborative, more transformative, and more caring. no longer thinking about our work in terms of audience development, but in terms of communal sustenance, embracing concepts of collective care, linking our values and principles to those of fellow activists, prioritizing the commons, taking care of the health of our planet, as well as those who live on it, and putting ourselves at the center of the efforts to bring about a different kind of world. And I'll stop there.
That is a fantastic end to this webinar, collective care. What a great phrase. Thank you so much, Patrick, and apologies, you were a bit squeezed at the end. Ben, do you want to say just a few comments and then we'll draw it to a close? Can I just say before Ben does, over nearly 80 people were part of this webinar. So thank you very much to everybody who took part. Ben.
And thank you. I just want to say what a fascinating webinar we've just had, a range of issues. And for me, what really struck out is just the individual bits of expertise in terms of what people have been doing and different projects. And I've been following some of the chat that's gone on. Also sent, I can't use Zoom too well, so I sent a chat that I meant to my presenters about me wrapping up. So apologies for that. But it's I was wondering if we can save some of the comments that were on the webinar chat and we can send around to the attendees, because there's some interesting links and resources that have come out, which I'm sure lots of people would want to follow through. Just thank you to all the speakers for giving out your time and talking to us today. And thank you so much to Tracy for chairing. I just want to thank the members of the APPG as well, including my co-chair, Lord Howarth, but particularly also Alex and Hannah for setting this up, and of course the support of Arts and Health Southwest for their support towards the APPG so we can have events like this. Thank you so much, and I hope that this is the start of something special going forwards, I think, which is pretty much what every panelist has said, that we can capture some of the spirit in terms of different ways of working, the different ways of approaching things, and take it forward beyond COVID and helping people in different ways in the future. Thank you.
Great, and stay in touch, everybody. And apologies we didn't get to questions, but do reach out and I'm sure the conversation will continue. Thank you, Alex. Thank you, Hannah. And thank you to the APPG. It's been a pleasure to be with you for the last wee while. Thank you.
Thank you. Thank you, everyone.
Thank you.